It depends very much on the type of skin cancer. Some are inherently greater risk than others. It depends on how early it has been caught, and it depends, crucially, on how superficially it is located within the skin. If a tumour's got some sort of palpable depth, then non-surgical methods aren't likely to work, so surgery would be recommended. But often with these regular skin checks we were talking about, we can pick these up early. And if they are superficial, then there are non-surgical treatment options available. So specifically there's creams we can talk about, and cryotherapy, which is liquid nitrogen. And these appeal to some people because the advantages are that they often cause less in the way of scarring. So as long as you pick the correct tumour, where you know that the non-surgical treatment is going to have a great chance of working, then it can be a very good treatment option. Shall I tell you about the creams? The creams, typically, there's one called 5-fluorouracil, trade name of Effudix, which has been around for a long time. So that's actually chemotherapy in a cream, and can be used for background sun-damaged skin with sunspots, called solar keratosis, but can also be used for some early superficial skin cancers. That's a cream that you would target the lesion you're going to treat, and you would apply it twice a day, typically for 3 weeks. The downside is that it makes it a little bit more inflamed. It does cause the lesion to become red, maybe a little bit itchy, sometimes a bit sore. So it gets worse before it gets better. But that then settles within a week or so of stopping treatment. And then if you've chosen the right lesion you're treating, there is a good chance it will have gone, often with no scarring whatsoever. So that one certainly stood the test of time. There's a more recent competitor in the market, if you like, for Effudix, called ingenol mebutate, trade name Picato. Works a completely different way. So this is a natural product, an extract of petty spurge or milkweed, pioneered in Queensland, although this is a weed that's found throughout the world, which works in a different way. We're not entirely sure how it works, but you put it on for 3 days only. So compared with the 3 weeks of Effudix. Now, so for that reason, it's extremely popular. It's been around for about 18 months. We're still getting a feel for it, but the short-term results appear to be as good as Effudix, again with often zero scarring. So yes, surgery isn't inevitable. We will always discuss these options.